I just got my budget package and I see this tremendous amount of money that we're budgeting for occupational health and safety. I live in a residential building. We're not in a factory or some industry making widgets. Do we really need occupational health and safety? I mean, it doesn't seem to fit. On the surface, it doesn't seem to make sense. But occupational health and safety and the associated training, or maybe it does make sense. Here to help us understand occupational health and safety today is Deborah Howden. Deborah, you are a lawyer with Shibley, Righton, LLB. Really, thanks for coming today. This is something that I see all the time. It tends to be one of those things that gets cut out of the budget right away. So let's start with the obvious. Does a residential setting really need occupational health and safety?
Unequivocally, yes. And the reason for that is even though it's a residential setting, it's also a workplace. So we want to think about people like cleaners who are dusting lobby furniture or wiping the inside of elevator cabs, security personnel who are at the security desk or wandering the property, or even property management staff who are managing the day-to-day affairs of the property. So there would be other service providers as well. So even though it is a residential setting, it's also a workplace. And as a workplace, Occupational Health and Safety Act compliance applies, which means policy, programs, and training. A lot of the people that I just mentioned are going to be subject to their own health and safety policies through their own employers, but it's important that there be site-specific policies and training that dovetails with those policies. And the reason for that is these individual communities are going to have different amenities. They're going to have different hazardous products. Some communities are going to have pool equipment, chemicals, others not. Master key policies, emergency responses, all sorts of pieces that are going to relate to health and safety. So it's not one size fits all. It has to be site specific.
Oh, darn it. I thought one size fits all was going to work here. Okay, I can see why the manager and the condo or the strata needs to have something in place because it is a workplace. But legislation is pretty thorough. And do they really need to have occupational health and safety committee or reps and take minutes and hold meetings? Do they have to have all of that?
So it's a good question, and the legislation actually speaks to where the condominium has to comply. So 5 workers or less, you don't need a health and safety rep or a committee. But anywhere between 6 and 19 workers, you do need a health and safety rep. And beyond 19 workers, you actually need a health and safety committee. And that committee would be comprised of a worker representative and an employer representative. Where you just have a health and safety representative, that representative has to be chosen by the workers. And the general duties are to identify workplace health and safety hazards, to be a liaison between the workers and the employer on health and safety issues, and also to work with the corporation in relation to health and safety related policies. So I'll give you an example. There's a requirement under the health and safety legislation to have anti-violence policies. Before you have the anti-violence policy, you need to have a workplace risk assessment. The health and safety representative should be involved in establishing those workplace risks and in developing the policy.
Oh, okay. Okay. I can see that because some employers would simply say, no, it's your fault.
That's right.
Yes, okay.
That's right.
So there's these legislative requirements. I get that. Now, how would a condominium corporation go about putting an occupational health and safety program or being WHMIS compliant? How would they go about that?
So WHMIS, for those of you who need a refresher, stands for Workplace Hazardous Materials Information System. It's a mouthful. And it's a Canada-wide system that deals with labeling and identifying products and their safe handling and use. So under a WHMIS system, every hazardous product has to be properly labeled and come with what we call an MSDS, a Material Data Safety system information sheet
Right.
that talks about what the product is and how it's safely handled. So WMIS really looks at three things. It looks on the use, the handling, and the labeling and storage. I said three, it's really four, of these hazardous materials. So in terms of a policy for training, what you would want is, first of all, you'd want the product to be properly identified.
Right.
So you don't want to have, a jar of clear liquid that's actually sodium hydroxide and it's labeled water. That's a safety concern. You also want to obtain or prepare the MSDS, the material safety data sheets, which are going to provide more information that's on the actual label. It's going to tell you how to use the hazardous product and how to store it and safe handling. And then the last thing and the most important thing, well, in health and safety, it's all important, but it's important not to forget, is the instruction and training. So every worker has to be trained on how to use and interact with these products. Sometimes PPE, personal protective equipment, is going to be necessary for some of these chemicals.
Right. We learned that through a pandemic, didn't we?
We sure did.
So I've heard that the Ministry of Labor can sometimes do these surprise inspections, and that they come in looking for occupational health and safety programs, training records. What sort of records, I'm sure it's more than that, what sort of records would the ministry be looking for? And perhaps more importantly, what happens if there's no occupational health and safety program in place?
So you're right, Mary. Certainly since 2020, we've seen a real increase in MOL unannounced inspections, and they call them proactive inspections. In fact, I think right before the pandemic, they were averaging about 45,000 a year, and now they're up to 75,000 a year. So it's taken a really sharp curve up. But in terms of training records, they're going to be looking for a record of all training that has been given to the worker to complete. So they're looking for the name of the worker, they're looking for who delivered the program, they're looking for a brief description of the training that was provided. And what I like to do, and it's a good practice, as soon as the worker receives that training, it's good to have them sign an acknowledgement that they've received it, and that can go into your training records. And if the MOL ever attends your premises, you can say, look, we even have the worker's confirmation that they received that training. But what sort of training would take place in a condominium setting? You're looking for things like training for working at heights. So under the Occupational Health and Safety Act, 3 meters or more, or 10 feet, would be considered working at heights, and you would need some fall protection, some fall arrest protection for that. So there should be training in relation to that. And that training has to be refreshed every 3 years. You also would be looking for perhaps some ladder training, which also can implicate training at heights. Mold in a suite can actually migrate fairly easily from the suite into the common elements. So a training program to assist workers in identifying the risk of mold and addressing those issues promptly. And then lockout procedures. So imagine having a garbage chute and having your worker come and work in the garbage chute without the power being disconnected or it being locked out and tagged as is required under the Act. So all those training pieces are going to be relevant in a condominium setting.
Yeah, and we don't often think about that in a residential setting.
Now, you asked, what happens if you don't have that training?
Yep.
So two things typically, there are two typical orders. One is a compliance order. So the ministry will say, within 3 weeks, we need you to have this training in place. Or more seriously, it can be a stop work order. So worker X cannot continue handling these chemicals until you deliver this training. In more serious cases, or where a condominium corporation is uncooperative or is a repeat offender, it can even escalate to issuing a ticket with a fine or charges under the Occupational Health and Safety Act. And by the way, I didn't mention, but when the MOL has this surprise inspection, they don't need a warrant. This is not like the police coming to search your premises. So they have broad sweeping powers under the Act.
Yeah, and I understand that when they come to the scene of an accident, they actually call it the scene of a crime.
Yes.
right?
Yes.
So they're assuming that somebody's at fault before they even start their inspection.
They can.
Yeah. Okay, so I can see the occupational health and safety training, and I can see the programs as being important. Now, I know that all of the directors that are watching this here today are going to ask this question. In an urban setting, so in one of the cities, let's say we're looking at a 200 to 250 suite condominium. What kind of costs are we looking at? Is this going to be exorbitant, or?
It depends on how you define exorbitant. It's a good question. Assuming you're starting off fresh without anything, it's probably a good idea to budget around $5,000 for personal protective equipment, eye wash stations if you're going to be dealing with hazardous chemicals. Thereafter, I would budget a reasonable amount, maybe somewhere around the $1,500 to $2,000 range cost for updates in training and equipment and inspections. There's probably a separate piece that's going to be required for the Occupational Health and Safety program and policy.
Right.
Safe bet is to budget around $3,000 for that. And then the recommendation is that those policies be reviewed at least annually, because under the Act, there's a requirement to review it regularly. And the budgeting for that might be around $600 to $800. So that's ballpark. Don't quote me on that, but that's a ballpark figure.
So I guess one of the cautions that I would want to give the directors that are watching this today is what's going to be more expensive, putting the program in place or having a death of a worker?
Very fair point. And of course, the answer is obvious. It's the death of a worker.
So before we close, what final piece of advice would you give to those directors that are watching this?
So it's going to sound a little trite to say, but a safe condominium is a happy condominium. So a lot of these things can be a little bit intricate, especially the WMIS compliance and other compliance. It's a really good idea to bring in a certified professional who knows how to do these inspections and identify gaps and identify breaches. So that's something that I would offer as an advice. But really, when residents and staff feel safer, they tend to feel content and calmer, and then everybody thrives in the community. So the big takeaway, I think, from my perspective is make safety in your condominium community a priority. Don't skimp. That's my advice.
So what you're saying is the only thing more expensive than a professional is an amateur.
That's right. Well said.
Well, thank you for coming in and talking about this today. And I know that a lot of directors out there don't quite understand how important this is in their workplace. The workplace is the residential environment. So there you have it, folks. If you've been cutting that out of your budget, don't do it anymore. Until next time, I'm Murray Johnson, and this has been Your Condo Connection.